In this training session, I want to show you how to add a private duty patient that does not require orders. After you sign into the application, you're going to select your patient's menu, and then you're going to select the Add Referral Patient option. The referral is done in 4 parts. There's a Create Referral, Set Up Patient, Contact Info, and Finish Referral. So we're going to start with the Create Referral first. First thing you're going to do is select your agency. If you have more than one agency to choose from, then you would select the appropriate agency from the drop-down list. Next, you want to select the agency type, and in this case, I'm going to select Private Duty. Then I'm going to select a referral source. Referral source can be physicians, facilities, other referral sources like Medicaid waivers, Cigna HMO, self-pay, other third parties, and trust officers. You can look at the information for admits or non-admits from this referral source within the last 30, 60, or 90 days. And you can also select your method of delivery, but you can leave this blank. You also have the ability to select a referral source contact. And so I'm going to select the individual that's in the contact file. If an individual does not exist that you're talking to, you can select the Add Referral Source contact link to add this information. Next, I want to select initial referral information. So the payer that I'm going to use is going to be private pay. Then I've got a referral date. I can backdate this if I've taken the referral on a previous date. And I can also have a requested start of care date. Next thing I want to do is select a paraprofessional service, such as a home health aide, other paraprofessional chore services, homemaker, personal care aide, and so on. So any one of these would be classified as a private duty. If you were also providing skilled nursing, you would be creating physician's orders. So I'm going to select personal care, and I'm going to select the continue. After I select the radio button, it's going to take me to the next step in the referral process, which is the setup patient. You'll notice that the first section says is physician's orders required, and since these are paraprofessional services, it automatically defaults to no. If for some reason the payer requires physician's orders or the referral source requires physician's orders, then you could change this to yes. Then the next step in the process is to search for the patient. So I'm going to enter patient name information. And I can put in as much information here so it'll find as much information within the patient encounter record. And so I can enter the medical record number if I know this patient was previously in the system and I knew that number. Or I could put in their patient identifier number. And in this case, since this is a private pay, that most likely will be their social security number. Then I'm going to select the search button. If it finds a patient or a listing of patients that meet any or all this criteria, it's going to show the patients listed in the Readmit and Existing Patients section. And if the patient does exist, you'll be able to check at one of the boxes for the patient that you want to readmit, and you can select the Continue button. So in this case, the individual that I want to admit is not listed in the Readmit section. So I want to go to Add a New Patient. So I already have their last name and first name and their birth date, and I can add as much information in this area as needed. If you have an email address, you can include the email address as well. Then you want to select the Continue button. After I select the Continue button, I move into the next step of the process, which is now the Continue Information section. So in this area, I want to include patient demographic information and any patient contacts. So I'm going to go ahead and select Add Contact Info. And when the pop-up screen displays, I'll be able to select the type of address I'm adding. So in this case, I'm going to be seeing the patient in the home, so I'm going to put their home address in the system. And once I put that information in, then I want to identify a phone number or multiple phone numbers. So I'm going to first select a home number and add that phone number into the file. And I'm also going to select a mobile number. As you can see, I have two numbers listed to the right of the screen that I've entered. I can check the box for one of the numbers that I want as a preferred contact. So I'm going to check home and then select my Save button. Now, if you need to add work or mailing addresses or any other type of address, you can select the Add Contact Info to add a second address or subsequent addresses into the contact information section. You also have the ability to enter patient contact information. So I'm going to select the Add Patient Contact link. I can identify the patient's relationship. And so the relationship to the patient is sister-in-law. And I can identify whether this individual is going to be a primary caregiver in the home, next of kin, an emergency contact, or if you need power of attorney or willing to provide all patient care. So then I'm going to enter the name. And the other fields you can leave blank, but if you choose to collect the information such as date of service and other miscellaneous information or notes, you can enter that information in. Sequence will automatically be assigned. Then I select the Continue button. And on this screen, you can identify the contact's address and select the type of address it is. And I'll enter the demographic information. And then the contact's phone number. So I'm going to go with my home phone number first. And then I'm going to add a mobile number. And as with the patient contact information, the referral information for this, I can identify the primary number that I want to call. So I'll check mobile and hit my save. Then when the screen redisplays, you can see the contact information and the preferred phone number is checked in green. And again, you have the ability to add multiple contacts for this patient. Once I'm completed with this information, I select the Continue. After I selected the Continue button, you'll see that I'm now in the fourth step of the process, which is called Finish Referral. It brought over the requested start of care date from the Create Referral page, and then I can put in an anticipated end date of care. If this is greater than 6 months, you'll want to put a 6-month time frame for an end date. Otherwise, if they give you an end date for this, then you'd want to enter that end date into the anticipated end date field. You can also add any additional referral information that pertains to this actual patient referral. Then you can determine the days of service for the services that are going to be provided. And in this case, this is going to be personal care, and we're going to do them on Monday, Wednesday, and Friday. And so personal care will be mapped out in the schedule between 9/28 and 12/31 of this year. Then I'm going to select the Continue button. Once I select the Continue button, it moves me into the patient encounter record as a pending patient. The next step in this process would be to add the payer. So while the patient is still pending, you can verify payer information, especially if you're working with another third-party payer. So I'm going to select the payers link. And while I'm on this screen, I'm going to select the Add Payer link. Now, the self-pay payer is the payer that's going to pay for this patient's services. So this is the payer that I want to add, and I will select the green plus sign to add this payer to the patient. From the Payers tab, it's automatically going to display a pop-up. On this pop-up, it's going to identify the sequence, and since this is the first payer and the only payer that will pay for these services, it'll automatically default to sequence 1. Then I'm going to enter a start date for this payer. I can leave the end date open-ended because this is the payer that's always going to pay for the services being provided. Then I want to select the billing address. And if the patient identification type is going to be a social security number, it will automatically default. If you have an ID number in place of the social security number, then you can select the ID number from the drop-down. So then I'm going to enter a social security number. And then I'm going to hit my Save button. As you can see, the self-pay payer has been added to this patient's encounter, and that's the payer that's going to be billed for services being provided. Now I want to schedule the initial services. So I'm going to select the Schedule Initial Services link. And it's going to show me for a start and end date. And in this example, I used 9/28 to 12/31. And that I've got personal care checked as my discipline. And so I'm going to schedule that service. We said it was going to be done on Mondays, Wednesdays, and Fridays, starting on 9/28 and ending on 12/31. And then you have the ability to select the service, whether it's a personal care aide hourly or a personal care aide discipline. And the services will show up based on how your service codes are established in your system for your office. So I'm going to go ahead and select the service, and I'm going to select my Save button. Now what this does is it attaches all these scheduled services between 9/28 and 12/31 to the patient's scheduling calendar. So once you schedule those services, you can access the patient's scheduling calendar by selecting the scheduling link that displays at the top of the page. So after I schedule the initial services, the next thing you want to do is activate the patient. So I'm going to select the Activate Patient link, and I'm going to enter information onto the Activate Patient pop-up. So I'm going to have a start a care date. It will have their home address, but if you need to change it for a service address, you'll be able to do that if the service address is in the file. Then you'll be able to identify admission source. And in your case, admission source would be information not available. The admission type is typically elective. If you have a case manager that manages your private pay cases, you can do that. If you do not have any clinical manager that would be responsible for a private pay case, and you can leave that blank. If you're using the team concept, you can identify and assign a specific team. And the rest is information you can leave blank, so you simply select the Save button. So now you can see that your patient is now active. Next thing you want to do is to be able to go to the scheduling portion of the application by selecting the scheduling link that's at the top of the screen. After you select the scheduling link, the patient's schedule is going to display. You have basic information pertaining to the patient that's at the top of the screen. You have some additional features such as mass cancel, which will allow you to cancel one or multiple records at the same time and provide a reason for why you're canceling the services. You have the ability to add a pay only, which is for any service that's not related to direct patient care that you want to keep track of or you need to put on a schedule and link it to a patient. You'll have the ability to add a pay only and link it to a patient using this option. Down the left-hand side of the screen, you're going to see a list that meet the discipline that you're going to schedule for. So if you need to change this to a different discipline, you can select that discipline from the drop-down box and move to another discipline to get a list of associates that you will see that could be scheduled for this patient. Since it's automatically defaulted to personal care, I'm not going to change it. When you're working with the patient schedule, you have a legend that tells you about the scheduled services or the status of the scheduled service that appears on this patient scheduling calendar. So green says it's been assigned to an associate. Yellow means it's unassigned, but that's not the discipline you're working on currently. Red means that it's unassigned, but that's the discipline that you've selected to work on. Once you've provided service and verified it, the scheduled service will change to blue, means it's been verified for payroll and billing. And if you cancel services, you have a checkbox to show canceled services. And when you select that checkbox, any item that's in the scheduling calendar that's in a tan color are your canceled services. You also have the ability to move an associate into a scheduling conflict, which means that either that associate doesn't want to see the patient or the patient doesn't want that associate to come back to their home, and you can select the Add Scheduling Conflict link. So when the pop-up screen displays, you're going to find an individual out of the list, and you're going to type a note as to why they're no longer going to be allowed to see the patient. And then once you're through putting in your notes, you can select your save. And now for this patient, you'll never be able to assign that associate until you remove them out of the scheduling conflict. Now, sitting over on the right-hand side of the screen is the patient scheduling calendar. Since I am working with the patient scheduling calendar for the personal care aide, my scheduled services appear in red. Now I want to show you how to assign associates to a patient's schedule. There are two ways to assign an associate. The first way is to assign it to an individual service. So I'm going to select the service on the patient scheduling calendar. And I'm going to get a little pop-up, and I want to select the edit link. And when it displays this link, I want to be able to assign an associate to the patient schedule. So I'm going to click on the associate. If I need to schedule times, I can put the times in on this screen as well. And then I want to select my Save button. And so now you can see that it appears in green, which means an associate has been assigned to the patient's schedule for this specific date. Now you can look at the rest of the calendar and see that there are other scheduled services that have not been assigned to any associate. To do a mass assign, I can come up to the associate that I want to assign to the service and select the scheduling calendar icon that has the green bubble, and it'll show me all the services. And if all the services are to be provided at the same time, I can put in the same time. And then I can select the Save button. After I select the Save button, you'll see that all the services have now been assigned to this associate at one time. So now let me show you some other features that are available to you. When you select a scheduled service, you'll have other options available to you. If you've already got one assigned, you can still edit it and reassign it to another individual. You can actually unschedule the service, and I'll go ahead and do that. And so this service is no longer assigned to any associate. So if I wanted to just assign this scheduled service, I can come back in and to the edit screen and I can select my associate and select the Save button. You also have the ability to cancel the service, so if the service is not going to be provided for any reason, you can select the Cancel button and then provide a solution, reason why you're canceling it, and your resolution date, and then confirm the cancellation. And so now you can see that that service no longer appears. Now, if for some reason you canceled it by mistake, you can select the Show Cancel button. And you'll see that it now appears on here in a tan color, and you can select the scheduled service and you can uncancel it or restore it to an active service, and select your Continue button. So you can see that I brought it back up as a restored service and it's still assigned to this individual. You also have the ability to add a scheduling note. So if you want a note in here, you can put a scheduling note that your associate or your employee will be able to see. And then once you put in your notes, select the Save button. And then you will see that there's a little note icon on the right side of that scheduled service, and this one tells me I have one note. You can click on that little note icon and you can see what the note says. So I'm going to go back and select the services. You can also send a message to an associate. Since this is not HIPAA compliant, you do not want to put any patient confidential information in your message or in this note that you'd be emailing to an associate. So you'd have the ability to, if you need to link it to a team or a group of people that are assigned to the same team, or a discipline if you want it to go to all of your associates for that discipline, or you can select specific associates. And in this case, a specific associate has been selected because they're already assigned to the scheduled service. And then put in your message to them. And again, remember, it's not HIPAA compliant, so you do not want to put any patient confidential information in here. And then select your Send button. And so I'm going to cancel this because I'm not going to be sending a note out at this time. Now, when you're working with associates, at the left side of the list, you have an address book. And when you hover over that address book, you'll see all the address and phone information that's available to them. Their name is also a link, so you can see their scheduled services to determine if you really should assign them to this patient. And if it's got a green bubble in it, it means that they're a good match for the patient. If they have a red bubble in the match column, it means that they're not the best match for the patient, and they could be considered out of their territory. They may not be in compliant with all of their compliance requirements, and they may not have availability. You can still assign these individuals to the patients, but they should not be your first choice. Now, I previously showed you how to use the calendar icon that had the little green bubble to do a mass assignment. The one that's sitting at the right is a calendar with a red bubble that allows you to do a mass unassign. So in this case, I should still be working with the personal care individuals. So that's the discipline I should be working with. I did assign proctor to this patient, but I can mass unassign him. And I can unassign all of them, or I could be selective for the ones that I want to unassign. And the ones that I've removed the check marks from are the ones that will still be assigned. Everything else that has a check mark will change to unassigned once I select the Save button. And so now when I scroll down, you'll see that I've got several that are still assigned to one individual, and now I have others that aren't assigned to anyone. And you can select another individual out of the group to do a mass assign by selecting the calendar with the green bubble. And now you can reassign all those services to another individual by selecting the calendar icon with the green bubble. When a pop-up screen displays, you'll see all the services listed, and you'll see the time in and time out that was originally associated with them. And now you can assign them to a different individual. So if you determine that this individual is going to see the patient on all of these days and times, then you would just simply select the Save button. And then the calendar screen will redisplay, and now you can see that they're assigned to another individual. This concludes the training for entering a referral for a private duty patient that does not require physician's orders, adding the private pay payer, and scheduling the services based on the services requested.